Continuing our coverage of the youth mental health crisis. Yesterday, we told you about lawmakers working to reform the entire system, but a plan like that, if passed, would take a long time to get up and running. So today, we're focusing on the good that's happening in Colorado right now, helping families who wouldn't have care otherwise. 9 News reporter Anusha Roy is joining us now. And Anusha, there has been some movement.
Yeah, there definitely has. And when I was talking to health experts, they said what's so promising is that they've actually found programs that are working, when a few years ago, that wasn't even the case. And that really put families with kids in crisis in a dangerous and scary place. Too often, kids are still waiting for treatment beds in completely wrong places. We were talking about the emergency room or even county offices. Well, now with American Rescue dollars, the state was able to pilot programs like creating 12 units with beds for boys and girls with that more complicated and long-term needs. Beds and access to care that these kids and their families didn't have before.
We've served about 53 kids through that unit to date. The average length of stay can really vary. It can be from a couple of months upwards to 6 or 7 months. It really depends on the individual treatment needs of a young person. But what we do see is that's about 53 kids who otherwise would have been sent out of the state of Colorado to receive treatment.
And that is one of the most heartbreaking things that is happening right now, is that kids are being sent out of state for care. They're away from their community or anything that they are familiar with because there is nowhere for them to go here. But the reality is right now we're talking about just a couple of beds, and another 50 to 70 kids at any point are on wait lists for programs like this, not to mention all the other children that need other types of treatment right now as well. The state has also been working within foster care homes, creating 128 specialized foster care beds in the state, also expanding access to substance use treatment facilities. And while the money is coming in for these pilot programs, there needs to be the right kind of funding to scale up properly. And here's the thing, that even if there is money for that program, there simply are just not enough people to work these jobs right now. At the end of the day, though, if any of these sound like this could be helpful to you, there is no wrong door to ask questions to try and get in. That could be through your county Department of Human and Social Services, your pediatrician, Medicaid contacts, Children's Hospital. All of those are great options and a great place to start with finding out how to get into these programs. Reporting for 9 News, I'm Anusha Roy.
Well, Anusha, obviously this is a big problem. We're seeing glimmers of hope and obviously ways that we can get better. No matter what, no matter how you look at it, it's front of mind for everyone.
It absolutely is, especially with Children's Hospital declaring that youth mental health emergency. And the reality is for years that these families have been stuck in a really confusing, chaotic system. And Corey, they frankly don't even know how to get started. They don't know where to go. And especially when it becomes acute or long-term, you need something more significant. That's when it starts to become even scarier.
Yeah, it's kind of confusing to navigate all of it, but really appreciate your reporting on it, Anusha. Thanks.